as a final presenter to talk to you about the Okada Health and Wellness Program. My topic today is about its clinical effectiveness and scientific aspects as a whole person care and healthcare system based on local community networks. Next slide, please. In recent years, as I have had the chance to attend various international conferences, I am realizing more than ever that the global medical issues are a huge increase of medical expenses, lifestyle-related diseases and depression are prevalent. And disease prevention and appropriate treatment is not yet established. A combination wellness program and support by family and or community may be one of the best approaches to improve patients' lifestyle and quality of life. The Okada Health and Wellness Program is one such program. We integrate conventional medicine and Okada Health and Wellness Program and advise on healthy lifestyle in the MOA clinics. The Okada Health and Wellness Program aims to promote physical, mental, and spiritual well-being. It consists of three components of diet, art, and Okada PRN therapy. The diet component is arranged so as to achieve physical and mental health with an emphasis on so-called life energy in food. Through the program, people are encouraged to enjoy a grain and vegetable-oriented diet with fresh organic food in season. The art component aims to promote mental and spiritual well-being by introducing beautiful arrangement into daily life. Based on the general idea of enhancing daily life with beauty, the program recommends the enjoyment of fine arts and flowers. Okada PRN therapy is a modality of biofield therapy such as healing touch, and it is thought to facilitate physical, mental, and spiritual well-being by invigorating the self-healing ability innate within humans. First of all, I would like to talk about the scientific aspects of the MOA in nature farming, supporting the diet component of the Okada Health and Wellness Program. The theoretical framework of nature farming is that soil contains an infinite life energy, allowing all agricultural products to grow without fertilizer or chemicals. We will see an example of the benefits of the MOA nature farming methods in this slide. As an experimental study, 2 samples of the rice grains were bottled with water in 2004. One was grown utilizing the conventional farming method and the other the MOA nature farming method by the same farmer. In the left bottle, rice turned dark and spoiled. In the right bottle, we can see grains of white rice. Interestingly enough, it is still difficult to prove the benefit of nature farming for our health in the present scientific method. The soil from nature farming field is soft and warm, and it actually contains a lot of various microorganisms. We can see one example in this slide. This picture is rice fields in winter before snow. The same farmer grew rice for years utilizing the conventional farming method on the left and the MOA nature farming method on the right. As seen in this picture, the nature farming field is more green. After snow, it melted faster in the nature farming field than in the conventional farming field. As a summary of the nature farming, it is often said that nature farming products do not perish easily. The soil from nature farming fields is soft, warm, and contains a lot of various microorganisms. Nature farming plants spread one's root widely and deeply in the fields and farms. Nature farming is resistant to damage from cold weather and even seawater after the tsunami in 2011. And this is a case report of the art component of the Okada Health and Wellness Program, although the clinical effectiveness of mind-body intervention is often difficult to be determined. Just after big earthquake and tsunami in 2011 in Japan, we visited several refugee camps for medical and mental support. A man in his 60s said in a depressed mood that he could not sleep and had stiff shoulders and lower back pain. Enjoying the art component of the Okada Health and Wellness program, he said, "I chose a white flower to start a new life from now. All my belongings were washed away by the tsunami, and I don't know what to do. I carried many corpses every day, including my family's. I felt nervous and could not cry, but thanks to this flower and delicious hot tea, I can shed tears today." Through the art component and the conventional medical support, I thought he was eased from tension and healed. In this slide, we can see the scientific aspects of Okada PRKine therapy. When we feel relaxed, alpha waves increased in the brain. The picture illustrates a human head viewed from above. The color changed from blue to green, yellow, and red, corresponding to the degree of increase in alpha brain waves. The data were collected from 10 volunteers, and the color indicates the sum total of increase in alpha waves in the 10 subjects. As we can see, alpha waves increased when the subjects were at rest, particularly in the right part of the brain. When the OPT practitioner said to the recipients, "I will administer OPT from now," but they did not administer it, alpha waves increased more compared with the control. This is called the placebo effect. This study revealed that placebo OPT increased alpha waves more than did the control. When the practitioners administered real OPT, alpha waves dramatically increased as shown in the slide. The recipients did not know which was real OPT and which was placebo. However, OPT had greater effects than did placebo OPT. Other studies suggest the change of autonomic nerve function during OPT. In order to clarify the clinical effectiveness of Okada PRKine therapy, we conducted a cross-sectional study where more than 60,000 Japanese participants received a single session of OPT in various settings. They evaluated the change of the categorized symptoms shown in this slide. Physical pain improved in approximately 70% of the participants and was exacerbated in 2.5%. Palpitation and dizziness improved in about 70% of the participants and was exacerbated in 1.1%. Anxiety and depression is also improved, is about 70% and was exacerbated in 0.7%. Most participants who experienced symptomatic exacerbation recovered in a few hours. No one needed emergency medical treatment. OPT is therefore considered safe and effective for various symptoms. However, the improvement rate varied corresponding to 4 variables, namely gender, reasons for participation, duration and location of OPT administration as shown in this slide. But how much is the difference between the lowest and the highest improvement rate? When male subjects without positive reasons for participation received OPT at their own home for just 30 minutes, the improvement rate was the lowest. As for physical pain, the improvement rate was 51.5%. When female subjects with positive reasons for participation received OPT other than their home for 15 minutes or longer, the improvement rate was the highest. The improvement rate in this case was 80.8%. We understand that many factors were associated with the outcomes. This slide shows the effectiveness of administration of Okada PRKine therapy for 12 consecutive months for those with sickle cell disease. Sickle cell disease is the most prevalent genetic disorders in the African region and frequently causes severe anemia, multiple organ failure, and early death. This slide shows a change of hemoglobin levels in a 1-year study period. The control group includes 20 patients who received the conventional medical treatment only. The hemoglobin levels in the control group increased after 1 year as shown in the yellow squares. On the other hand, in 20 patients who received OPT every weekday for 12 consecutive months, severe anemia significantly improved as shown in the pink squares. In the patients receiving OPT, not only anemia but also renal and liver dysfunction improved significantly. OPT may be effective treatment for relieving various symptoms caused by incurable diseases. We have also investigated whether the Okada Health and Wellness Program influences quality of life and sought to determine the factors associated with improvement of the quality of life. In this study, 5,111 participants used the Okada Health and Wellness Program for 3 consecutive months and reported how often they practiced each component every week during the period. They answered the quality of life questionnaires before and after the intervention period. This table shows that the factors associated with higher cure scores at baseline. The baseline score was consistently higher in the male participants aged 80 years or older without apparent illnesses who frequently practiced the diet and art component of the Okada Health and Wellness Program before participating in this study. After 3 months, the cure score significantly increased in those less than 50 years and frequently practiced the art component during the intervention period. Frequent practice of the art component was therefore a consistent factor associated with a higher quality of life. The latest studies suggest that a healthier lifestyle is to quit smoking, take low and fat diet, and control weight. The problem is that to improve one's lifestyle is very difficult for anyone. Support for healthy lifestyle is indispensable. Mind-body interventions such as art therapy improves quality of life. Biofield therapy improves physical pain compared to the sham treatment. Those supported by families and communities have a better quality of life and well-being. Religious beliefs and or high spirituality influences medical outcomes. A whole person care and support system could change outcomes and reduce the medical expenses. I'd like to talk about MOA's healthcare system in this slide. As a medical center of the MOA healthcare system, we have been constructing MOA clinics. In the MOA clinic, we integrate conventional Western medicine and the Okada Health and Wellness Program and advise on healthy lifestyle. There are 13 MOA clinics in Japan and 10 MOA clinics outside of Japan. Now, thanks to all of your help, the 24th MOA clinic is open in Hawaii here. Thank you very much. MOA has also been developing local volunteer community networks, and we call it MOA Healthy Life Networks. Medical staff in the MOA clinics advise how to improve lifestyle, but the MOA clinic alone cannot support patients in their daily lives. Healthy Life Networks play an important role of supporting patients to improve their lifestyle in collaboration with MOA clinics. MOA integrates all medical resources in order to support patients' healthy life by a network of people who care about others. In our concept, patients and families are at the center of the integrated healthcare system, and members of the integrated healthcare team give them sufficient information and support their decision about the treatment methods. The integrated healthcare team consists of at least local hospitals for advanced treatment, public health services, MOA clinics, and healthy life networks. The MOA clinics and healthy life networks supports people's healthy lifestyle by means of the Okada Health and Wellness Program. From the international point of view, I think MOA's healthcare system can be a prototype of creating healthy cities advocated by World Health Organization. As I mentioned previously, MOA's healthcare system includes conventional medicine, whole person care, to promote physical, mental, and spiritual well-being and support by family or community. MOA recommends the Okada Health and Wellness Program as a whole person care. In Japan, we usually use Japanese cuisine and Japanese traditional art to heal others. But in Hawaii, you may be healed more by Hawaiian cuisine and Hawaiian art. The main concept of the diet component is to eat fresh and seasonal food materials, avoid excessive seasoning, eat larger proportion of grains and vegetables, and eat with gratitude. The main concept of the art component is to enjoy the harmony of the natural and man-made beauty, associated flowers, and enhance daily life with beauty. We could use other alternatives when such programs match these concepts and promote physical, mental, and spiritual well-being. Thank you very much for your attention.